Doctors don't want you to know this, because if you find out what I'm going to tell you today, you will forever give up expensive pills that destroy your liver and kidneys. Today, I will reveal to you the Swedish method for normalizing blood pressure. Simple, accessible, and completely free. A method that was known and used in Soviet medicine, but was then intentionally forgotten under the pressure of pharmaceutical corporations. You wake up in the morning, and the first thing you feel is heaviness in the back of your head. Your head feels like it's filled with lead. You get out of bed slowly because you know that if you stand up suddenly, dark circles will swim before your eyes. You go to the kitchen, measure your blood pressure, and again those numbers. 160 over 95, 170 over 100, sometimes higher. You take a pill, then another one. The pressure decreases a little, but your head remains heavy, your legs are weak, and your heart is anxious. Does this sound familiar? Then listen very carefully, because the next few minutes could change your life. In my many years of practice, I have observed thousands of patients with hypertension, and I have long come to a conclusion that is confirmed by Scandinavian medicine. Most cases of elevated blood pressure in people over 55 years old are not a disease of the blood vessels. It is a disease of the nervous system. Today, I will tell you 5 specific steps of the Swedish method that will normalize your blood pressure in 2 weeks, without pills, without hospitals, without money. So, what is hypertension really, and why do doctors continue to treat it incorrectly? Blood pressure is the force with which blood presses against the walls of your blood vessels. Normally, the upper pressure does not exceed 130, and the lower pressure does not exceed 85. When these figures are consistently higher, the heart is forced to work under double the load. Imagine a pump that is pumping water through clogged pipes. The motor overheats and wear and tear increase. This is how your heart wears out with untreated hypertension. But here is what is important to understand. There is primary hypertension, when the blood vessels are truly diseased, narrowed, and have lost elasticity, and there is secondary hypertension, when the blood vessels are healthy, but the nervous system constantly sends them signals to constrict. And this second type is the most common in people your age. It cannot be treated with pills. Pills only suppress the symptoms. The cause remains. Ignoring high blood pressure has specific consequences, and I will tell you about them directly. The first year with constant pressure above 160 leads to increased wear on the heart muscle. After 3 years without proper treatment, the risk of stroke increases fourfold. A stroke is not just a hospital visit, it is a loss of speech, a loss of movement, dependence on others' help for the rest of your life. Additionally, there is kidney damage that develops slowly and unnoticed until one day the tests show terrifying numbers. Most people make one critical mistake. They take a pill, the pressure drops to 130, and they think, there, everything is fine. But they don't ask, why does the pressure rise again the next morning? Why does it rise every time they get nervous? Why do they need more and more pills? Because the cause is not addressed. And now I will tell you what truly raises blood pressure in people over 55 years old. The first reason is chronic overactivation of the sympathetic nervous system. Simply put, your nervous system is stuck in alarm mode. This mode was activated long ago, from stress, from the loss of loved ones, from difficult life events, and it has not turned off. In this state, the adrenal glands constantly release adrenaline and cortisol, the blood vessels are constantly constricted, and the heart is constantly tense. The second reason is sleep apnea. 9 out of 10 of my patients with stubborn hypertension snore. Snoring is not just a sound. It is a sign that at night you stop breathing for several seconds dozens of times. Each such stop is an oxygen starvation for the brain, a release of stress hormones, and a sharp spike in blood pressure. In the morning, you wake up already with high blood pressure, although you don't know why. The third reason is magnesium deficiency. Magnesium is a mineral that relaxes the smooth muscle of blood vessels. When it is lacking, the vessels are in constant spasm. According to modern research, more than 70% of people over 60 experience chronic magnesium deficiency, and most of them are unaware of it. The fourth reason is hypodynamia, that is, a sedentary lifestyle. When you move little, blood circulation slows down, venous return to the heart worsens, and the heart is forced to work harder to pump blood. The vessels lose their training and elasticity. And the fifth reason is the one that is talked about the least: loneliness. Swedish researchers from the University of Gothenburg have found that elderly people living in social isolation have an average blood pressure that is 14 units higher than those who engage socially. This is not a metaphor, it is physiology. Loneliness activates the same stress mechanisms as physical danger. Remember what I'm about to say. The real reason for your high blood pressure is likely not in your blood vessels, it is in your nervous system. And this is why the Swedish method works where pills only mask the problem. The Swedish method was developed in the clinics of Stockholm and Gothenburg Gothenburg in the 1980s. Its foundation is the activation of the parasympathetic nervous system, the part of the nervous system responsible for relaxation and recovery. When the parasympathetic system takes over from the sympathetic, blood vessels dilate, blood pressure drops, the heart slows down, and functions steadily. Here are 5 specific steps. Step 1. Morning diaphragmatic breathing. Right after waking up, without getting out of bed, place one hand on your chest and the other on your stomach. Take a slow breath in through your nose for a count of 4. Your stomach should rise up while your chest remains almost still. Hold your breath for a count of 2. Exhale through your mouth for a count of 6. Very slowly, as if you are blowing on hot tea. Repeat this cycle 10 times. Exactly 10, no less. It takes about 2 minutes. Diaphragmatic breathing activates the vagus nerve, the main nerve of the parasympathetic system. After 2 minutes of such breathing, blood pressure decreases on average by 8 to 12 units. This has been clinically proven. Step 2. A cold compress on the back of the head. Take a small towel, wet it with cold water, and wring it out slightly. Lie down or sit comfortably. Place the compress on the back of your head and neck for 10 minutes. The cold causes reflexive dilation of the brain's blood vessels, reducing the tone of the sympathetic nervous system. Our grandmothers knew this. They said, cool your head, warm your feet. And it's not just a saying, it's a folk physiology that modern science now confirms. Step 3. Magnesium foot bath. Fill a basin with warm water, not hot but warm, about 37 degrees. Add 3 tablespoons of regular pharmacy magnesium sulfate. It costs next to nothing at any pharmacy. Soak your feet for 20 minutes. Magnesium is absorbed through the skin, enters the bloodstream, and relaxes the walls of the blood vessels. Swedish doctors recommend taking such a bath every other day in the evening before bed. Within a week, most patients note that their morning blood pressure has decreased by 10 to 15 units. Step 4. A walk of a strictly defined type. Not brisk walking, not running. It's a walk at a slow pace, so that you can speak freely without getting out of breath. 30 minutes every day. The point is not in the load, but in the rhythm. Rhythmic movement synchronizes the heart rate and lowers cortisol levels. Soviet preventive medicine, the very one we lost, required all retirees to take such a walk every morning, not without reason. It worked. It still works today. Step 5. The evening ritual of relaxing the nervous system. An hour before sleep, turn off the TV and phone. Sit in a comfortable chair. Take a glass of warm milk with a teaspoon of honey. Milk contains tryptophan, which lowers cortisol levels. Listen to soft music or just sit in silence. This is not weakness. This is medicine. Your nervous system needs to receive the signal. There is no danger. You can relax. Only then will the pressure begin to truly decrease. Now about nutrition, because without this, the whole method works only halfway. There are 3 things you need to eliminate immediately. The first is table salt. Not to reduce, but to eliminate completely, at least for the first 2 weeks. Salt retains water in the body, increases blood volume, and raises pressure on the vessels. Instead of salt, use lemon juice, herbs, garlic. Second, coffee and strong black tea. Replace them with rosehip broth or green tea. They, on the contrary, gently lower blood pressure. Third, fatty sausage, lard, fried meat. They increase blood viscosity, creating additional strain on the vessels. What should be added to the diet? Beets. Beets contain naturally occurring nitrates, which in the body convert to nitric oxide, a substance that dilates blood vessels. Half a glass of freshly squeezed beet juice in the morning, and after an hour, blood pressure will drop by 7 to 10 units. British scientists tested this in clinical trials. Additionally, walnuts, flaxseed, garlic, parsley. This is not a diet. This is your medicine, which is available at any market and costs almost nothing. Now definitely, about precautions. This method is safe for most people, but there are conditions under which you must consult a doctor before starting. If your blood pressure regularly rises above 180/110, this is severe hypertension and self-treatment is unacceptable. If you have already had a stroke or heart attack, any changes in regimen require medical supervision. If you are taking several medications to lower blood pressure at the same time, do not stop them abruptly. This is dangerous. Stopping the pills should occur gradually, under a doctor's supervision, as blood pressure stabilizes. Diaphragmatic breathing is not recommended in severe bronchial asthma during an exacerbation. A cold compress is contraindicated in acute cervical osteochondrosis. Replace it with just a cool, not icy one. Do not start all 5 steps at once. In the first week, focus only on breathing and walking. Get used to it. Feel the first results. In the second week, add magnesium baths and a compress. In the third week, completely restructure your diet and introduce an evening ritual. Haste is the enemy of results here. Measure your blood pressure every morning at the same time after sitting quietly for 5 minutes. Record the readings in a notebook. You will see, in just 7 to 10 days, the numbers will start to change. The systolic pressure will decrease by an average of 12 to 18 units. The diastolic will decrease by 8 to 12. This is not a promise of a miracle. These are average figures provided by Swedish clinical observations. Let me tell you about Tamara Nikolaevna, a 72-year-old retiree from Samara. She wrote to me 3 months ago. Her blood pressure had been at 165/170 for 6 years. She took 3 different pills every day. She had constant headaches, and she almost stopped going outside, fearing she would feel worse. She started using this method, at first with skepticism, then with surprise, and finally with joy. After 2 weeks, her blood pressure dropped to 145. After a month, it was down to 135. Her doctor, seeing the results of the tests and measurements, gradually reduced her dosage of pills. Right now, she is taking only 1 pill instead of 3. She is walking again in the mornings. She is meeting with friends again. She says she has gotten her life back, and she is not alone. I have dozens of such stories. If this information was helpful to you, click the like button right now. It will take a second, but it means a lot for the channel. Your like helps YouTube show this video to other people who are currently suffering from high blood pressure and don't know what can be done without pills. Write in the comments, what step will you start with? Or maybe you have already tried something similar and got results. I read every comment. I often respond personally. Your experience is important not only for me, it is important for thousands of people who read these comments in search of hope. If you have loved ones with high blood pressure, send them this video, not tomorrow, right now. You could literally save someone's life, or at least improve the quality of that life. Share in the family chat, send it to a friend. It will take 15 seconds. Subscribe to the channel and hit the bell so you don't miss the next video. Next time, I will tell you something shocking about the most commonly used medication that millions of elderly people take every day. You will learn what it does to your joints and kidneys and discover 3 simple ways to protect yourself, even if you can't stop taking this medication. This is important. It concerns you. Don't miss it.